Hi everyone, this is Madhu and welcome to my channel, Twins Mumma. Today I'll be talking about spit-ups in infants. I have already published a video on this topic in Hindi. This video is particularly for those viewers who are more comfortable in English. There would be numerous instances in the journey of your motherhood when you would notice that you have just fed your baby with breast milk or formula milk only to watch them spit up that. In this video, let's find out what are the causes of spit-ups in infants and what we can do as mothers. Spitting up is quite common in healthy babies if they are lesser than 3 months old. 50% of all healthy babies experience such instances when the contents of their stomach comes back or comes upwards towards their food pipe or the esophagus. And in medical terminology, this is known as gastroesophageal reflux. Normally, the lower esophageal sphincter prevents the contents of stomach from coming back towards the esophagus, and it is nothing but a muscle flap between the lower part of the esophagus or the food pipe and starting of the stomach. Now, in case of infants, especially below 3 months of age, this particular sphincter is not properly developed. Because it is not properly functioning and it requires around a year for the digestive system of an infant to properly function, there might be instances when these contents from the stomach comes up, and that will result in spit-ups which we see in our babies. So, as a new mommy, it is very common or it is very normal to get worried about the spit-ups, but you need not worry about it. This is just a part of growing up of your baby, and by the time your baby celebrates his or her first birthday, this kind of problem will usually be outgrown. But yes, as a mom, you should know the difference between spitting up and vomiting. When a baby spits up, it is a very slow process wherein the contents drool down in a very slow fashion. But vomiting is a forceful process wherein the contents from the mouth may shoot out few inches. So, as long as your baby is eating well, your baby is comfortable and he or she is gaining weight, you should not be worried about the calories that is being lost in this kind of spit-ups. As a mom who has raised twins and as a medico, I would like to give you some tips which as new mommies you can keep in your mind while feeding your baby and in and around the time so that there are lesser instances of spit-ups. You cannot prevent spit-up totally, but yes, you can manage them to a certain extent. So tip number 1 is, whenever you are feeding your baby, keep your baby upright. When you are breastfeeding, you can use one pillow below your thigh so that the head end of the baby is little raised and the upper body as well as the head of the baby is in a higher position as compared to the stomach and the lower body. If you are someone who feeds formula milk or pumped out breast milk to the baby while making the baby lying in a horizontal position on the bed, you should keep in mind that the head end of the baby should be elevated utilizing pillows. And if spit-ups are very frequent in case of your baby, then you can decrease the amount of milk which you give at a particular feeding session and increase the frequency in which you give the feedings to your baby. So, lesser the content of milk in their stomach, lesser is the chance of spitting up. When you use a bottle for feeding the baby, keep in mind that the size of the nipple and the size of milk flow through it, through the hole which is present in the nipple, should be according to your baby's age. Next point is that once you feed your baby, keep your baby in an upright position for the next 25 minutes to half an hour so that the milk settles down in the stomach and the chances of regurgitating it back through the esophagus to the mouth is lesser. Moreover, do not engage the baby in any kind of jerky movements or active play or swinging the baby. This kind of movements may lead to more amount of spit-ups. Burping your baby is very important. Take time to burp your baby between the feeds and after the feeds. Especially if you are feeding your baby using a bottle, he or she may gulp lots of air inside and that may cause spit-ups later. Ideally, you should keep the baby in an upright position for 25 to 35 minutes, as I have already told you, after feeding. But provided you have some urgent work and you have to make the baby lie down on the bed, make it sure either you keep the baby in slightly sideline position or you can elevate the head end of the bed. When you are feeding your baby, there should not be any tight clothes around the baby's stomach or waist. Moreover, the diaper size should be taken care of. You should make your baby wear a diaper according to the baby's age as well as baby's weight. So I hope by now you have understood that spit-ups are quite common in babies and a mom need not worry about it. But yes, if your baby is not gaining weight or baby repeatedly refuses to feed, in such cases, there might be some underlying pathology. Moreover, if the baby spits up some green or yellow colored fluid or bloody or coffee colored fluid, accompanied by blood in stool or difficulty in breathing, or baby crying a lot more than usual or more than 3 hours per day, in such instances, consult your pediatrician as soon as possible. I hope through this video I was able to answer all the queries regarding spit-ups for new mommies. For such similar videos on parenting and pregnancy, kindly subscribe to my channel and don't forget to hit the notification bell so that as soon as I upload a new video, you come to know about it. Thank you so much. See you soon with another video. Till then, take care.